What kind of a rhythm is that?
Section.
No, that's a VF. Okay, so take that off and start doing CPR, because he just died. Okay, no, don't do this.
This simulation was stressful enough, but medical students today are facing a decision that's not only crucial to their future, but also to the entire healthcare system. Whether they choose a specialty like surgery or they practice general medicine, the need unquestionably is for the latter.
And we need to rethink the cost of a medical education and do more to reward medical students who choose a career as a primary care physician, who choose to work in underserved areas instead of the more lucrative paths.
The University of Washington here in Seattle puts a lot of emphasis on primary care, but interviews with a variety of second-year students who just returned from a summer program that sends them to rural or underserved areas reveals that financial incentives are only one piece of their decision.
Some of these students get out there and they see the doctors they're working with almost killing themselves, working 80 hours a week.
You hear about the stories of physician burnout and going into primary care, and it was just kind of really reiterated over the summer.
It's just a ton of work.
And you don't have the time to really sit down as some specialists might.
The one pediatrician that I worked most closely with would, between 9 and 5, would see approximately 40 to 45 patients.
Graduates here are slightly more likely to be general practitioners than the national average, and the divide is noticeable between those that are leaning towards primary care and those that aren't. The experience made Kylie Boggess, on the left, more likely, but Jessica Wilczek less so.
My heart is in it, and this just sold it to me.
Or do you think you're leaning more or less towards primary care than you were
Before. Maybe less.
It was a close-up experience with the challenges of primary care in very rural Montana.
I think if you could have more time, the quality of care would be higher.
And so we can train residents.
And it had the opposite effect on Miss Boggess.
You get to have a very personal relationship with your patients. You get to be their doctor, which is fun.
Grab a survey.
But even the short summer experience made her realize the difficult road ahead.
Life is hard, and I would go home thinking about my patients a lot and realizing that I needed to learn how to balance that so I could be present in my life at home as well as present in my life at the clinic.
And of course, there are financial considerations.
It's so tempting to be sitting in a position and knowing that I could go do something else that will make me 4 times what I'm looking at with primary care. The temptation is huge.
Hold CPR, pick up the paddles, don't push any buttons, put the paddles on the chest.
The experience suggests that increasing the number of primary care doctors will require more than forgiving their student loans.
Charging?
The lifestyle implications are a primary concern.
Whether or not you want to have time to go to your potential future son's or daughter's soccer game at night may impact, if that's a value for you.
And it could get worse. What reform would mean in terms of increasing demand has not fully been grappled with.
You can't get an appointment now, Mr. President. How are you going to get an appointment then when there's 46 more million people competing for that doctor's time?
Well, this is going to be a significant issue. First of all, I think it's important that whatever we do, we're going to phase it in. It's not going to happen overnight.
At the end of the simulation, the patient, or rather the technician behind it, made the decision to pull through.
Did you see the light and come back from it, Chris?
On the larger question of where to go in their career, it often comes down to the perception, often dim, of what these students think the world will look like by the time they're ready to practice real medicine.
Instead of hoping for the best, I guess I'm preparing for the worst.
I would really like to be able to practice in a world where I can just take care of my patients, and that's the end of it.
People are looking for a quick fix, and I probably won't even be in my career as a physician before things turn around.